We've got a lot of things to cover here. Welcome today. Oh, and for you who don't know, Kevin started and ran Mayo Clinic's medical device security program. He's a rock star. He's been there, done that. Not only does he have the t-shirt, but he can sell the t-shirts if he wants to, because he's really a thought leader. And so it's really a privilege, Kevin, to be able to interview you here. So I know we're here to talk about standards, but and really the reason that hospitals need to know this information, but maybe you could just give us a high level overview of what we want to achieve today and how the standards factor into the foundation that we talked about in our first session.
Well, the standards really help you in multiple ways. One of them is just, quite frankly, it can give you some information on what you got to do. And so I'll take it. Most of the standards have gone through a consensus process. They've been vetted. And so you now have a really good base of things that you got to do. So for operational things, it works out great.
Mm-hmm.
You also can take those standards and you can then use them for everything from helping to drive checklists, helping to drive what's in your contracts, and using those standards even to hold some of the vendors accountable for what their standards are. So don't think of standards just as your own internal activities, but think of standards as for anything involving that whole life cycle. There's also
and that guidance. So are there any other benefits to using standards other than just the operational security guidance?
There's a couple external ones as well. One of them is that HHS recently has set up a safe harbor so that if you do have a breach and you're able to show that you've done a acceptable plan on your cybersecurity for the last year, you can have those fines potentially reduced. The other thing is there's just I'm not making this shit up, there's actually a standard that comes out of this. So when you go talk to leadership, you go talk to other vendors, you really end up with a much more credibility than just sort of, we made this up on our own. And you find that leadership has a lot of, they think that information security is sort of like this big black hole that sucks dollars.
Mm-hmm.
By moving more towards a standard base, you can also get beyond that and being able to say, look, here's what we're doing, here's why we're doing it, here's the outcomes we're looking for. It's based on international standards. We use standards, particularly in healthcare. Standards are all over the place on how you treat patients, how you bill, what you got to do for CMS, what you got to do for Joint Commission. So it fits well into the model of all the other things that are happening within your institution.
Right. Yeah. That safe harbor regulation that you talked about, that's really a factor. And do you think that's going to have an impact in the executive suite or at the boards? I mean, is this going to raise the concerns and the effectiveness of a medical device security program to a higher level?
I think for places that are already heading down this path, this would be one more gust of wind into the sails.
One more Lego brick into the wall.
Yeah. And so I don't think that for the newcomers to these, for the 24-bed hospital, maybe 50 or 60-bed hospital who has one person or two people who do cybersecurity for the whole hospital, I don't think this is going to be, I think they're still going to roll the dice on this one. Because when they start looking at historically and what their costs are to put in some of these programs and what the potential fines might be, I think purely from a financial standpoint, it probably is not going to make a difference to them.
Okay.
It will help though as you're going forward, as one of those justifications when you're doing bullet points.
Mm-hmm.
Obviously, the first bullet point is my God, these are our patients, so we want to make sure that we don't lose their information, they don't come to harm, and their patient care processes are disrupted. And oh, by the way, if you're also a bean counter, here's a good.
It can factor into the risk model and the impact that it could have. And we do have one quick question. I can answer this one. The question is there a place where we can get a list of the standards? You've put together a comprehensive list. We'll supply that in the show notes and follow up. There's some, we'll be the resource in that, and we'll provide a link to that in our follow-up email to you. And for those who joined us just a little bit late, just want to let you know this is being recorded, and you will get just one email from us, and that will be the follow-up. We'll also give you an opportunity to opt in so that we can keep you advised of the ongoing sessions that Kevin and I will be having. Probably the third or the last Wednesday of every month is what we're planning on doing. So stay tuned, and if you want to opt in, we're not going to blast you with emails. So we'll be recorded, and we'll be providing that email follow-up so that you get all of the questions that we're not able to get to, and so on. So Kevin, I remember the list that you created. There are about 10 organizations that are providing guidance and standards and control documents. How do you recommend that a healthcare provider would sort through all of these standards and coordinate or otherwise make sense of all that information? Because it can be daunting.
Yeah, it can. I have found that if you peel a lot of these standards down and you get right down to the base activities of it and what it's telling you to do, there's huge similarities between all these, which helps you understand that there's not one totally right or totally wrong. And quite frankly, at the core of all of these being similar is makes sense, because the basic cybersecurity practices are the basic cybersecurity practices, and it really doesn't matter whether you've got a Windows machine for an administrative assistant or a Windows machine that's running a medical device. So don't worry about choosing the right one. What needs to be done is that the institution needs to choose one that, for lack of a better term, speaks to them. There are a lot of ones out there that vary in complexity. There's ones where you can pick up a NIST standard and has 500 different guidances. You can pick up something which is a bit smaller, which is, for example, for the Center for Net Security, has a small and medium business activities that you can do, which again are based on standards. And if you look a lot of these, you'll see a lot of the cross mapping on these. For example, that the cybersecurity framework really has cross mappings to all of the different ISOs, and that so that really making sure you get the right one is less of a problem, because they're all right.
Sure.
You need to choose one which has the amount of depth that you need, the amount of breadth that you need, and quite frankly, if there's other standards that are in use by either vendors that you use, internally that you have, and so then you need to be able to choose and try to keep that consistency. So a lot of it is not only actually having the items, but it's what sort of emotionally and intellectually resonates with your institution.
Yeah. And one shameless plug, I've done some mapping of the different standards, and I seem to recall that you were pretty impressed with that. So if somebody wants to engage one-on-one, we can talk about that as well. So What standards, just real quick, and this is a question that came to us before from John in Pittsburgh. What standards have you seen used before? You don't have to list all 10, obviously.
So to take a step back, when I think of standards, I think, I love my buckets and I love my hierarchies. So when you look at standards, you want to be able to take a look at some sort of a base standard, or at least some sort of base to this. And that usually for most people is like the cybersecurity framework.
Yeah.
And that gives you the ability to look at a larger program, and gives you the ability to set some sort of roadmaps, even beyond your medical devices. If you just decide to institute, ISO 80001, medical devices that are networked, without taking those base steps, you're just going to fail because you don't have the infrastructure and the institutional buy-in to that. So you're going to want to start with something like the NIST cybersecurity framework. From there, you can move on up and start looking at things like 800-53, which is the very broad cybersecurity framework of NIST. From there, you can move up and start looking at things where the 80,001, which is the medical devices. There's also some special ones that are put out about infusion pumps and some other specific devices. So if you start looking at things like cybersecurity framework, which is NIST, you start looking at ISO, and if you start looking for things like Center for Internet Security, if you keep those in front of you, those are really the ones that are going to work out best. So, your 800-53 is really good down there on that bottom level. You can start going up to 1808, which is for infusion pumps. And so think of it that way, of stacking them upon each other and the farther up that stack you go, the more specific they then become to your medical device program. And again, just to keep pushing this, and one of the other things I didn't talk about with standards is it can not only drive your work in cybersecurity, but if you get the buy-in on these, it can help drive others' work as well by flipping these into metrics. So if you're having
absolutely, yeah.
So if you're having difficulty with your networks team, which every place I've ever visited in my life has difficulties with their networks team, and you're driving some of these standards as well, that allows you to help set them outcomes as well, and allows you to set metrics on that.
Yeah, and that wasn't a slam at the network teams. They've got their priorities and their things. And one of the things that I found that you're very effective at is bringing those different siloed departments across a hospital together to help them understand the needs and the drivers, because I've seen many times, the director of biomed walks into the CISO's office or vice versa, and the first thought is, uh-oh, what now? So we'll come back to the metrics in just a second. The other thing that two organizations that have done a lot of great work as well is really on the vendor management and supply side, being HISAC, that you're working with on SBOM and some other great people, including Axelworth and some noted hospitals. So you've got the SBOM work that's being done, and then the MDS2 or the MDS squared from MDISS that HISAC's also administering.
Yeah, one of the big challenges for institutions, particularly smaller ones, is how do you take all these parts and fit it together into a coherent program? And so that's one of the biggest challenges with these standards. And I did a lot of work with vendors, and vendors I think actually like to work with us because we were pretty succinct. We were prioritized on what has the potential to cause patient harm or disrupt patient care activity. And so our questionnaires, which again were standards based, were somewhere around 100 questions.
Yeah.
Vendors would show me where somebody, it looks like they they took 800-53 and turned it into a 500 question questionnaire. And it contained things that were not applicable for their situation. So that
Sure.
the really is the key to a lot of these is you're going to want to go through and not worry about the minutia in there when you start.
Sure.
My guess is the majority of the people who are on today could take a highlighter, go through most of these standards, think about your environment on what's going on. So what are your most common devices? Okay, so how do I want to, what parts of my standard can I use for that? What do I need to do for remediations to be, and what are my most common vulnerabilities? So
Right.
what to the standards can I pick up for that? And that gives you a ability really to focus and not start turning into the standards minutia.
Mm-hmm. From Albany, New York, another pre-question that we had was, and this steps back to what you were talking about as far as metrics. I mean, how do you fit metrics into all of this?
Well, when you look at metrics, back to my buckets, there are operational metrics. And so, for example, one of the things I've done in the past is I would, we measured throughput time. So from the time that somebody requested a purchase of a new medical device to the time that it was onboarded, because that's a big deal. And because you can't let that run out 6 months, 8 months for a couple reasons. One, frustrate your proponent. The second thing is if this is something that's going to help people, you want to make sure that it's there and it's helping people.
Yeah. So how does that factor into maturity and risk?
So this really doesn't factor into maturity and risk if you're looking at outcome measurements like you're talking about. This is how you manage your processes as you go forward, making sure that your customers are good, making sure that you have the right resources, because hopefully you'll be able to tell on that. If you're looking at risk and things like that, you're going to want to be able to pull in some other metrics as well as start looking at some outcome metrics. So, for example, you're going to want to be able to develop a individual risk score for your devices. Those risk scores are going to be based upon subsets of some of those standards. So those standards will tell you that you should upgrade your operating system, that it should meet this criteria for network connectivity, those types of things, as well as it will help, you can use some Joint Commission data to be able to look at potential for patient risk. So by combining those two, what the risks are based upon a standard score, looking at some of your Joint Commission score as far as patient impact if that device fails, that will give you a pretty good risk measurement based upon your individual devices. Then you're able to take that individual device and you're able to add all of those together and you get a fleet risk score. Now that you're talking about those, the fleet risk scores are things really that you're talking about institutional risk for this. Those are the things that end up going to your board of governors. It goes to your executive team. They like to have that number. You're going to want to be able to track that over time.
Right. Okay.
Individual.
So it really comes back not so much the metrics on risk or maturity, that sits on the side, but it does have a direct impact on best practices and operational impact.
And the risk also, once you're able to get that risk for the device, you're now able to slice and dice that. And that actually can either be, you can kind of boost those metrics up to a leadership level if you're looking in that and you find out that, holy smokes, everything that is a high risk is in radiology, which gives you some data to work on and areas of opportunity.
And a sponsor as well.
Exactly, and lets you go that direction. The other thing is you can then take those sort of middle tier metrics and push it down of where you know what, if we see that our risks are higher on radiology devices, okay, we now have the ability to say, are we going to want to do more resources there? Are we going to just want to accept that risk? Are there other mitigating factors that we can put in place for that? And what that drives is when you have that risk measurement, which is a moral high ground, and as it should be, measurement of where
Mhm.
this is what's going to happen to the patient if something goes bad. So ultimately, it's, do we hurt somebody,
Right,
or
right.
do we delay care for somebody?
Yeah, and that's what I hear from so many hospitals who are far down the path of developing these programs is this is really about patient safety. That's the driver, and that's what speaks to the executive staff, if you will.
And so once you get that risk measurement by device, again, that lets you drive things like, do we want to do a special project? Do we have to have a discussion of, do we want to change vendors? Or quite frankly, do we have the mature discussion, which is still very hard for a lot of places to be? Are we just willing to accept that risk if we aren't willing to pay the dollars or do whatever it needs to be to mitigate that risk? And
Right.
and that's okay, but that's an individual institution decision, and one that should not be made by information security.
Sure, sure. Um, so what's the quickest way for a hospital to get up to speed? Let's say we're operating in a green field, or we've tried to go down the path of unsuccessfully getting executive sponsorship and getting the recognition from the executive suite we need. What's the quickest way for a hospital to get up to speed and to progress down the path of getting to a good level of maturity by implementing these standards and guidelines and controls?
Um, Quite frankly, the best and easiest way, if you're going to just jump right into the deep end of the pool, is to start out with your NIST cybersecurity framework, and let that drive the overall program. That's a nice one too, because you can use some, you can kind of bastardize the CMMI type measurements and turn that into a institutional metric scorecard for you as well.
Mm-hmm.
You're going to want to layer on top of that the 800-53. And for that one, you're going to want to be able to go through that and pick out the parts which will help focus the institution on the things that will reduce your risk the greatest.
Okay.
This is back to the example of, somebody turned the 853 into a questionnaire, and now you have 500 things you got to scroll through. If you're dealing with too many things there, you just lose it.
Right.
Quite frankly, your institution probably, if you're looking to be able to start things like this, your institution's not ready for the whole thing of that.
So what's a measurable number if I'm looking at 500 potential factors?
If you go back and you start pulling out somewhere between 100 to 150 things that you want to be able to meet with, in for example 800-53, that's a good number to start with. It's an understandable number, people can work with it, and you're going to want to take those and match it to what's going on. So
Mm-hmm.
things that match the most of your equipment, things that match most of your risks, those types of things to really push the priorities up and not getting sort of lost in the dust there.
Yeah, that way it's not rocket surgery, right?
No, the whole key to this, and where a lot of institutions fall apart, is they take a standard and they look at it from a full encompassing, we got to do the whole thing, versus taking the 20% that may be able to get rid of their 80% of their risk as a starting point, and I'll take 80% of the risk off the table right
Right.
off the bat without a problem. And
Well, if you take, the 20% of the 20%, those are your really big wins, and those are the ones that you can highlight to the executive team, and that tends to create some momentum to really get things rolling.
and once you have your 100 or 150 at that level, then you're going to want to start stacking upon it individual standards that are much more specific in the area that you're looking at. The 80,001, which is networked medical devices, has a good list of things and it's not as long. There's also that special workout, that 1808, which is for infusion pumps. So then you can start, as you're gaining maturity and you want to be able to really become much more medical device domain specific, you can then take those and stack it on top and add those to the things that you're always doing, continually looking for what gives our biggest return, what do we have the infrastructure and the ability to do, and how are we going to measure that as we go forward.
Right. And to dig down a little deeper, what are the processes that you find the more successful healthcare organizations are doing to set the standards into practice? How do they organize that?
So when you get down to the sort of the core level of a broad framework, for example, and if you decide to do a level of maturity on the cybersecurity framework, that by measuring that then gives you a roadmap based upon those metrics. So quite frankly, if you are good at that, that will drive your annual planning, and that also should drive your annual budgeting. So those difficult conversations, and mature conversations of do we accept the risk or not, get pushed back to back even into the planning phase of, okay, here is our score for our overall program. It does look like we're falling behind and we aren't mature on this one. We want to put a project in place next year, but it means we're going to have to do this versus this, our total risk score, and so it drives that conversation and really allows you to set a roadmap and to measure progress on it.
Right.
So it's a lot of this, particularly in healthcare and information security. If you take a step back and become data driven, because we as an industry for a long time, and particularly for non-technical people, have almost used a fear tactic,
Mm-hmm.
the fear in the unknown, as opposed to, look, we have a national standard for this and we're not meeting it. And for executives in healthcare, they understand that. Here's the Joint Commission standards. We aren't meeting it. Bad things happen.
Right.
Here's some other HHS standards. Here's HIPAA. We're not meeting it. Here's the bad thing that happened. And so now you're falling right in line with how the institution is doing the business for the rest of their work.
Yeah, you're being business driven, but you're talking in the language of the executives, because what we find is that there's so much sky is falling about hacking and the potential catastrophes. Yep. That when it doesn't come true, the executives tend to become numb to that. So it's really about the compliance, the risk factors, and really bringing the standards, because there's, when I go through the NIST work or the CIS controls, the JPS and all of that, there's so much excellent work. And, you've participated in a lot of these standards committees. You look at the lineup of rock stars that have been doing this for 10, 12 years, and they're right there at the core of the passion and doing this the right way and applying that practical experience. You don't always find that from these standards institutions, but they've done a really, really good job in that regard.
One of the things that we've been talking mostly about internal use of, that we did a lot was for external use. Mm-hmm. So, for example, we would take a lot of those standards and we would write them into contracts. So they needed to be able to, the device needed to have this type of capability. It needed to have this kind of protection. We even were able to push into things such, for example, like with the Joint Security Plan, as far as that came out of HISAC, which has a lot of vendor type standards in there,
Hmm.
vendor
Hmm.
practices. You're now able to start talking with vendors as well and hold them accountable for the standards as well that they should be for. And again, this is there's two outcomes to this. One is just a right good outcome, everything like that. So you got the moral high ground. The second part is that the validity of what you're asking them to do. It's a little hard for, again, for a vendor to say, well, we don't believe in the ISO standards when they're already trying to do things like ISO, what is it, 14791 or whatever, the one that they use as far as managing software defects. So
Hmm.
it, again, it can really drive a conversation of where you should be in kind of a non-threatening manner, as opposed to just saying, you suck, you
Right.
should do this. It now
Yep.
becomes, look, HISAC has put this out, there's been vendor participation. Are you doing these activities like your peers are telling you you should be doing?
And I've seen this really incredible response from the manufacturers, because now they can make changes to their processes and their information and their alerts and everything else, that they don't have to replicate or customize for each hospital that they're interacting with. So that activity at HISAC and MDISS, and even as it rolls up to some of the federal regulatory areas, it's really a solid collaboration that's going on of all parties.
Yeah, and when I've had the, over a couple of beers and more than a couple of whiskeys with the vendor cybersecurity
Hmm.
guys, they're really um, thankful for customers to be able to push some of those standards, and to drive some visibility in their work that they're doing, because quite frankly, they end up with the same kinds of difficulties that we do internally. So they still have, culture, they still have budget problems, and so this allows them as well to help become your advocate there by pushing these standards internally, and saying those magic words. The customers are requesting this, or the customers are requiring this, and we
Right.
need to do it for sales.
And conversely, they're also educating those prime users, like the head of radiology, on a lot of the issues. So that natural consistency of the message can help raise the awareness across, top to bottom as well. And then I guess one thing that I admire you for very early on is engaging with the vendors and providing. I mean, just the safe harbor thing that you brought up earlier. Hospitals, particularly the cybersecurity people, may not be uh, uh, reading those news feeds, or it's not popping up into their LinkedIn feed, so it just slips by. It's that bridge between the manufacturers that you and in MedSec, by having the manufacturers and the hospitals as customers, that's pretty unique, and you're able to drive that work with the Philips and the GE and the Bronze of the world. That's really a powerful place for you to be sitting.
Yeah, we were lucky, um, that I developed enough capabilities there to really go all the way down to pen testing and work with the vendors.
Hmm.
The idea that, if we were able to do that in-depth kind of testing interactions with the vendors that got put into standard product, that, part of the mission of when I was at Mayo was, we want to make the healthcare environment safer. So anything that we were doing, we required that they put into their standard product as well. so that there was industry benefits. And that quite, not only is that good for the industry, but also the last thing you want is a one-off piece of technology at your institution.
Yep. So we're coming up toward the end of our time, and I want to thank everybody for joining us today. And if you're listening to the recorded version, we'll put Kevin and my email up there, or connect to us on LinkedIn. If you have any questions or follow-up, you will be receiving, from registering with a valid email, a note from us with the links and everything. So last question, Kevin, it's kind of wide open. Your closing thoughts, and we can bring it to a close with that.
I guess in my closing thoughts are, don't go running around trying to invent stuff that's already there.
Right.
And a lot of what this is taking those standards, taking what's out there in the industry, which is really some good stuff, filtering out the stuff that you really think will have the greatest impact on your institution. And then it's not a standards issue anymore. It becomes a operational leadership, collaboration issue as you go forward. And by using those standards, those industry recognized activities, as far as your base goes, that gives you a huge leg up when you start walking your way into those operational standards, because they know that you aren't making this stuff up. You've got references that if they need to see. And if you start talking externally to vendors or not, they then understand this language as well.
Right, right. Good points. So Kevin, thank you for taking the time today. I know you're really busy, and you've got a lot of things going on in your life, not just professionally, but with the grandkids and such. Thank you so much.
Don't forget the afternoon naps too. You got
to siesta time. Yeah, but it's just about your time for your afternoon nap. So thank you for the time. Thank you everyone for joining us. We will be doing this monthly for the rest of the year. So you do want to opt in and look for our schedule, whether you bookmark that or you get alerts from us. We'd love for you to opt in. Feel free to give us feedback, frank and honest feedback, because we want to make this effective and valuable for you. Again, it comes to raising all the ships in the harbor. And that's really what Kevin has told me his mission in life professionally is to really help as many hospitals and bring his experience and knowledge to help as many people in this industry as possible. So thank you, Kevin.
You're welcome. Thank you, everybody.
All right. And so we're just going to add the emails here. So if you want to take a screenshot of that really quickly, you can do that, or contact Kevin or me via LinkedIn. I can put you in contact with Kevin or other industry professionals, as Kevin can, obviously. I know them. Kevin has worked intimately with them. So that's our contact information. Also, if you like to stay abreast of what's happening in the industry, the blog and the events at www.medsec.com is a great place to go. And again, thank you for joining us. And until next month, be safe, and bless you in your cybersecurity efforts. Thank you very much.